And, you know, that's where it is our responsibility to go beyond just cutting and stitching.
But, you know, I'm sure that you were as curious as we are now, and as people are who are listening, as to what it was. Do you think it was that, you know, he worried about his relationship with a woman who was now looked different, or that, you know, what was it about his initial reaction to her change in look that was alarming to him?
I wasn't privy to the finer details, but certainly a lot of husbands are very nervous when their wives want to look much better.
Mm.
They're concerned that the wives have got another agenda. I think mainly people are resistant to their loved ones having surgery because
they're concerned.
They don't know. They're not well informed about the surgery. They don't know how safe it is. They think something might go wrong, and they just want to carry on the same.
So you would hear from time to time, and I'm sure that for most of the time you're able to reassure people. You know, you would hear perhaps a couple who comes to you when most particularly the wife, and I'd like to also your opinion about men but who have surgery, because it seems to be more common now than it used to be. That
very much
they turn around and they say, but what do you want to go through all of this for? You know, I love you just the way you are. Is that not enough? I'm sure you hear that often.
I hear that often, and then a few months later, the husbands are just so happy.
Mm.
So, you know, fortunately, the vast majority say, you're doing it for yourself, I support you, go on with it. But, and then, of course, they say they have no interest in the size of the breasts whatsoever. This is the wife's project. And then when she comes through with the sizes on and the surgical bra, they say, can we try one bigger?
Now, as you know, we've got Dr. Maureen Allem here, who is a specialist in non-surgical procedures. So we've got a whole kind of range now of different interventions that people can have. So, I mean, and this seems to have developed quite rapidly, and recently all of these different interventions, and we've only just heard about one name, which is Botox, and I know there are many others that cosmetic doctors and plastic surgeons use. When should one, if one certainly is looking at improvement on let's particularly talk about a face, because I think that these non-surgical procedures are most specifically for the face, are they not, Maureen, or do they
face and the body?
Face and body as well. So, I mean, where does one come into it, ideally, and the other, as opposed to the other? Obviously, non-surgical, less invasive, no anesthetic, but I would imagine that if the results can't be exactly the same otherwise, or certainly not the same over long periods of time, so there must be a place for the different procedures. Dr. Stott?
Oh, indeed. Dori, I think it boils down to the fact that the non-surgical procedures will keep things tidy and allow people to look good for longer before they need definitive surgery. But at the end of the day, the skin is going to lose its elasticity, it's going to become lax, and just pumping in too many fillers and paralyzing too many muscles makes people look grotesque. And there is a time when the skin needs to be tightened, the fat pockets need to be pulled back whence they came from, and so on. So it is the responsibility of the aesthetic medicine doctor to say to the patient, look, I can give you 4 vials of Restylane at 70,000 Rand each, but actually it's time to go and see a plastic surgeon and get your face tightened. And then if you have some overactive muscles or some little creases, we can continue with the non-surgical techniques. And it's also, the plastic surgeon does the same thing. I mean, we have patients who come for non-surgical procedures and wish to discuss when is the right time to move on to surgery.
Dr. Allem, would you like to comment?
Look, if you start early enough, if you've stood in front of the mirror and pulled back on your jowls, that's the time to start all these non-surgical procedures. And it's pointless to come when you're 60, when the skin is really hanging. Then you're going to have to go cut that skin away. But if you start at an early age, from a say age of 34, 35, and you see that the jowling is developing and you're starting to develop a nasolabial line, those are all the early signs. And we have great procedures now. They can actually tighten the skin by 1 to 3 millimeters and also produce more collagen in the skin. And then we have lots of laser rejuvenation and many other collagen stimulating procedures like mesotherapy. We've got like fractional treatments, pearl laser, pearl fractional treatments that all stimulate collagen. And if you can keep your face firm and taut with collagen and elastin, your face, the skin on the face is almost like a support bra for the face, and that will keep you going for longer. As soon as you let the skin go with the collagen content in the skin going, then everything else starts sagging as well. So we do have procedures that do increase the collagen and the elastin in the skin. And as I say, some of the procedures do an instant tightening, and then they cause like a mini wound in the skin, and you get a whole inflammatory response. And then you get cells that make collagen, start producing the collagen and elastin. And then 3 months down the line, that collagen remodels, and you get further contraction. And if you can do a procedure once every year, every 2 years, you can look, who knows? I mean, it's still early days. I mean, I've been doing this for the last 6 years, and I think my face has held out. And hopefully I'll still be able to not have a facelift at 60. But, time will tell.
Time will tell.
That's why it's so important to start early, before the skin is too saggy. Then, obviously I refer patients to a plastic surgeon to go have a facelift.
Okay.
And I had, as I said, my last patient today, I said to her, she was 62 and her daughter was getting married and she had quite a saggy skin. And I said, you actually need to have a facelift, like a neck lift. And she said, surgery is out. I said, okay, then we go to the next level. Then we do the non-surgical procedures.
Dr. Stott, I thank you. You've given us so much of your time already, but I would like to ask you, do you get these plastic surgery junkies? I mean, maybe it's not in exactly the same vein as sort of unrealistic expectations as we were talking about earlier, but people who are very happy with the results and maybe do feel so good about the results that they keep thinking, well, okay, maybe just this one more thing, maybe a little bit more, maybe I'll wait a year and then have this, or maybe not even a year, and they go on and on and on. And I guess that's where the counseling skills come in, where you just have to say, look, perhaps you don't need this and enough is enough. People who just are never quite satisfied when enough is never enough.
Well, Dori, generally speaking, South Africans are pretty sensible people. And yes, we do have a very small percentage of those patients, but also don't forget that patients tend to select out the kind of doctors they think are going to offer them what they want. So different doctors may see this problem to a different extent. There's absolute total responsibility on the plastic surgeon to be utterly and completely honest. If the patient comes in and says, I can't see a result, and you see a beautiful result, you tell them. If the patient comes in and say, I want you to tighten this, and you know that it's going to make absolutely no difference to them after a great deal of expenditure, then you have that responsibility to say, no, I think that this is going to look false, it's going to not work, it's going to be a waste of money, etc., etc.
And just please, 2 more comments. The effect that it has on the way they think about themselves and the way they live their lives. Do they come in and tell you, or do you get a sense? And that must be possibly, as well as just looking at them and feeling so good about your work, maybe the deeper effect must be so incredibly gratifying to you.
It is absolutely wonderful. The warmth and appreciation of happy patients is quite amazing. I'm going to be very naughty and tell you I picked up a study on Medscape on the internet the other day, which they said that successful cosmetic surgery was 3 times as good as a course of antidepressants. Lifting the mood. But be that as it may, and whether it's true or not.
Well, I know what to do next time someone comes to me with depression.
The point I'd love to make is that at a serious level, one would like to say this is frivolous, it's superficial, etc. At a practical level, we human beings are terribly ageist. We're terribly affected by appearance. It is said that people make their impression of you in the first 10 seconds. They look straight into your eyes, they see your nose in the middle of the face, and after 10 seconds they've decided what sort of a person you are. So if you're looking old and tired and haggard with eye bags and droopy skin and so on, you've already been pigeonholed. And
it's quite scary.
I do believe it is scary. But we know that children who look nicer get better marks from teachers. I mean, all these things have been proved scientifically. So I am unashamed about the fact that I get enormous pleasure from making people feel better about themselves, and that's the only thing I claim to do. It won't get a new lover or bring a husband back or something like that, but it just makes you feel better.
Well, maybe feeling better about yourself gives you the kind of confidence that perhaps you were lacking and that you need to improve on, maybe not instantaneously, but perhaps as a first start. And that, practiced over a period of time with other skills, might get you the new lover in the long term.
We hope so.
And so just before we say goodbye, your comment about the number of men who are wanting to do these sorts of procedures?
Well, it's increased markedly lately. We did a survey in my practice that kind of over a number of years it went kind of 5, 9, 15, 20%. I think it's well over 20% now. Facelifts, liposuctions, noses, ears, eyes, of course, a very common operation, all those sort of things, and some more specific male surgery. But it's male.
That was naughty. I heard you say that.
Well, it's all part of plastic surgery, and it's only fair to the public to know that all these things exist and are safe, and they must just research them carefully, and they're available.
And certainly consult with a reputable doctor, seems to be.
And I think consult with 2 or 3 is a very good piece of advice. The Association of Plastic Surgeons always says, please go onto their internet and go see 2 or 3 people in your area and discuss your problem before you make your decision.
Dr. Hallie Stott, thank you very, very much for your time. 101.9 Chai FM, some excellent advice from you. Good night. Thank you very much.
Thank you. Good night, Dr.
And we're back on the couch. I'm Dorianne, Weil, Dr. D with you, and our special guest, Dr. Maureen Allem. And we're really talking about the relationship between how you feel about yourself and what you look like. And I think that listening to Dr. Stott, there is no doubt that whether it's good, bad, right, wrong, you should, you shouldn't, you must, you mustn't, there does seem to be a relationship, whether it's acknowledged or not acknowledged, for many people, not for all people, but certainly for some people, that they feel better about themselves when they look better. And the research that he referred to, and Dr. Allem, maybe you know something about the research as well, found it fascinating to hear, quite sad actually. I think it's quite a sad thing when you look at kids, that the ones who are better looking get better marks. That is quite horrifying to me, because he said that means that teachers seem to pay more attention to people who are better looking. Now, I did know about this research when it comes to jobs, that you do create, he said, as quickly as 10 seconds. You never kind of, as it goes, you never get a second chance to make a first impression. Well, actually, I think you do get a second chance, and you do get a third chance, and people do start changing their impressions about you as they get to know you, no doubt. But certainly the first impressions do count, and people want to make a good first impression. And you were talking about many of your patients who have hit 60 and over, men and women, who more of them who in the workplace who come for these non-surgical procedures than others who aren't. Can you just comment a bit more about that, because that was interesting? The ones who work, you said, come for more.
Look, there's a lot of competition out there. I mean, all these young WITS kids coming up who know a lot, who know what this whole new generation X and Y. I mean, they were born with computers, they were born with internet, they're born with television. It's just informed them so much. So they do create pressure on these elder people in the workplace. Like older, especially older women. Because they look older. You look older, you look like a granny. So
and you make assumptions.
Yes.